Do we have a quorum? You'll have to turn your microphone on, Steve, so they can hear you. Well, let's go ahead and call the meeting to order. And today on our agenda, I know it's just pretty much an update without any official actions being contemplated. So for that purpose, I'll turn it over to Monica.
Seems a bit formal, but
I know. Thank you, everyone. For the record, Monica Heltz, Director of the Health Department. We're just going to do an update today, as I know we haven't met in a bit, but we are expected to meet at least quarterly. So we're trying to get this in as the last meeting for the year so we can enjoy the holidays in December. So I just produce an update. So a few kind of things that have happened since the last meeting of note. One is that children have become eligible for the vaccine as of 2 weeks ago. Boosters for high-risk individuals happened since the last meeting, and people can choose any vaccine for the boosters. We may have additional booster approval today for all adults over 18. We're still waiting on those guidelines. FDA approved it this morning or yesterday, so people have started calling us about that. We have extended the Marsh lease to a month-to-month lease starting in January. I'm echoing. Also, Council has approved fee updates to the fee schedule with a few adjustments to our permitting fees, just to make them more clear and to offer the ability to add services. So an example of that is our fees for our clinic services previously only designated the ability to charge for vaccines, but we didn't have the ability to allow people to self-pay for those vaccines. So this allows us to bill for the vaccines at the rate that they're charged to us at, plus a small administrative fee. So, so that's an example of what was added. We've applied for some grants. Our CDC Public Health Associate has started as of a month ago, so that's new news since our last meeting. And we're very happy to have her. She's working on our mental health initiative. Her name is Renee. We have been getting a lot of things coming through the State Department of Health, just as money is being dispersed in different formats. Some of it we're participating in, some of it doesn't necessarily make sense for us to participate in. Some of that is like a cybersecurity assessment and a cybersecurity training for local health department staff that's coming out of the state. We're not receiving a grant for that. They got a grant for that, and then they're pushing that onto us. So that's an example of some of the different things. Other agencies have started calling about other workforce development types of things, and seeing, what our needs are because they are getting grants. So we're seeing some of that floating around right now. We did submit a couple of grants for different initiatives. The timeframe turnaround is shorter than our meeting schedules, so we didn't know about them at the last meeting, and we already passed the deadline for submission. So we've submitted a couple of grants. One would allow us to offer mental health first aid to up to 500 residents if we receive that grant. And that would be mental health first aid training, not just to be able to give first aid in mental health, but training for 500 residents to be able to do that as well. We haven't heard if we receive that or not, but we're excited about the potential that offers. We've also submitted a grant from the FDA to realign our code with the FDA code and make sure that we're on best practice and that it all lines up. So that offers the ability, is just some funding to send our inspectors to some trainings and conduct an assessment and do that work with a little bit of support. And then it's kind of a tiered program. There are only a couple of health departments in Indiana that have started in that program, but it does look like a best practice program. So our inspectors are really excited about that potential. Don't know if we'll get that one either, but we're excited about some of those opportunities as we build services. These are our numbers for where we're at so far this year. So lots of birth certificates, lots of death certificates. A lot of these categories we probably won't see for next year. If you recall where we were in January, we were still approving extracurricular events and those sorts of things. Those aren't anything that we're still doing. But the rest of the services continue as far as permitting and birth certificates, that kind of stuff. Communicable diseases, these are our cases to date. Obviously, COVID is the bulk of what we're seeing. And then these other infections are what we're seeing as far as other communicable disease reporting. We don't show the numbers when they are under 5. So we have received reports on those other items. They're just under 5, so we suppress the actual number. This is our most recently updated dashboard on COVID cases. You can see that we're having a bit of an uptick again as the weather has turned. This is consistent with what the state is seeing and what other northern states are seeing with the weather and with the holidays coming up. Obviously, this is concerning, so it's something we're keeping an eye on. But that's where we're at. And this is our just 30 minutes ago updated dashboard numbers. I will say that this does not appear to include the full report of the 5 to 11-year-olds that we have been vaccinating over the last 2 weeks. The data appear to be delayed in coming through the state. There's a lot of reasons for that. The vaccines were opened up before the state systems were quite ready, so they're having to go back and do some fixing on some of the entry that was done. We have administered, probably by the end of the day, it'll be 2,000 vaccines for the 5 to 11-year-olds. But we don't know how many of those were Fishers residents, and we don't know how many Fishers residents have gone elsewhere yet because that data isn't consistent yet from the state. So. This is a new breakout. Do you want to talk about this, Josh? Okay.
So the data files we received from the state on cases amongst our residents and vaccination status, I comb through that and match against to see who is a breakthrough case based on their vaccination status, or if they're a new infection, and if they're unvaccinated or partially vaccinated. And so on this graph here, I've broken it out over time since July, so right before the crest of the initial Delta wave, to where we are now with the increase in cases. So this is on the far right of the graph is the 7-day period ending on 11/12. The red line at the top shows the case rate, 7-day average per 100,000 For individuals that are 12 and older that are unvaccinated, they've been eligible to receive the vaccine since mid-May. The blue line are children that are less than 12, so 11 or younger. The yellow line is just the all community average, so keeping the whole community in the number of new infections. The green line at the bottom is fully vaccinated residents, 12 or older. And so you can see quite a large disparity between fully vaccinated residents, 12 and older. Their case rate's 13. The unvaccinated 12 and older's case rate is 84, so it's 6.3 times higher. So for the 7-day period ending on the 11/12, they developed COVID at a rate 6 times higher than the fully vaccinated commensurate population. So we're definitely starting to see a lot of divergence where the cases are concentrating. A bit concerning with the children younger than 11 because they only just recently became eligible and only a subset of them became eligible, but their case rate is now exceeding the community average by 50%. Overall, I guess I should talk about the bullets on there even though we can see them. Even though we have a very high uptake among our 18 and older population, so just around 87% have initiated the vaccination process, 83.7 or something percent is fully vaccinated to date. Counting, including the recently rolled on individuals, there's still roughly 30,000 residents that are in a various state of being eligible but not having initiated or recently became eligible and remain unvaccinated. So despite having a very high uptake, the virus is jumping into any susceptible host, and that's the unvaccinated population.
On that happy note. So we continue doing our control measures that we've been doing. We're still contact tracing. We're testing currently about 200 people a day. We've done over 81,000 tests between the two different testing streams that we use. Since the beginning of the pandemic, we've done over 68,000 vaccinations, all of them this year. And we've vaccinated over 700 people with our pop-up clinics. And that doesn't include an additional several hundred through our long-term care facilities and another 200 and something of our homebound individuals. So,
Monica, who is responsible for the booster shots for the nursing homes?
So nobody is designated as responsible for the booster shots for the nursing home. So we proactively reached out to them to find out if they needed support. So we've been going around to the nursing homes that asked for support. Some of them already had coverage through their home health agency or through CVS. And we're just making sure that everyone has some kind of coverage. And if they've got something lined up, great. If not, then we'll go in and do it.
Okay.
So those have been going really well. Communication, we are planning, I know we've done a lot of communication efforts, but the next thing is that we're planning a town hall style discussion with myself and Dr. Lane and a pediatrician as well to talk about any questions that parents may have about vaccines for children or any questions anybody may have with boosters and that kind of thing. So we're excited about that. It'll probably be the week after Thanksgiving.
Is that a virtual? Like
It'll be
Zoom?
virtual. Mm-hmm. It'll be very similar to your evening
Yeah,
Twilight town hall. Is that what it's called?
Yep.
Yeah. Let's see. So in other news, non-COVID related, where we're at, our environmental health program we've wound down our mosquito control and our open water testing. There's no real need for it at this point, and I hope nobody's swimming. And I think the mosquitoes have all been killed off. So we did end up treating one water source for mosquito larvae with the product that we had discussed with you all previously. Just so that you know how this kind of happens, we send in the samples as using the traps in the picture. We send them to the state. Once the county itself is designated as having West Nile in the mosquitoes, then we start looking for standing water, and then we would treat that standing water if it's on public property. So we were only able to locate one at that time that needed treatment, but we didn't have any cases of human West Nile that I'm aware of in the county, but there were a few in the state. Restaurants, we are working, I mentioned the grant application, so we're working on, our inspectors are doing some trainings with the FDA and working to kind of update those things as they're working towards transitioning from a pass-fail to a grading system for the restaurants. We continue to have very rarely some closures, but not any real recently, but occasionally they happen. The pools, in our pool code, a certified pool operator permit is required as part of our pool code, so everyone has been continuously notified all year. We haven't enforced it this year, but we've been doing a lot of education and notification so that everyone should be aware of and have had lots of opportunity to understand that for next year.
So just so I'm clear on that, Monica, the state law requires that if you have a commercial pool, that there is a designated certified pool operator associated with that pool?
It's not the state, it's our local ordinance.
In our local ordinance, does that deviate from the state's ordinance?
It's a little more strict.
Okay.
Yeah, and that's why we granted leniency this year and have been doing a lot of education so that everyone is aware.
Okay.
Also, I think in previous meetings, I've talked about the alert process for things like if we have West Nile in the county, or if we have our open water has high rates of E. coli and those sorts of things. So we were able to use that notification process the last time we had something like that. So it's in an email blast that people can sign up for. Anybody that signed up for our email newsletters. We also put it on social media that just says, if you're interested in knowing these things and you want the alerts, you can get them. So it notified basically of high E. coli levels. Not a lot of people were swimming when that came through, so I don't think it disrupted anybody too much. Other initiatives that we have, health education. We've been having, I think, a few people signing up for some Serve Safe training. We have the Dementia Friend training available for businesses. Our health educator has been certified to train people to administer youth mental health first aid. So we're looking forward to a partnership with the schools to be able to start training some teachers in that, and then hopefully expand it out with the assistance of the grant program that I mentioned previously. So that's the grant that would allow us to offer youth mental health first aid training and teen mental health first aid training to a lot of residents in our community. Vital records is continuing fine. I think we've ironed out all the wrinkles that we had last year. It seems to be going pretty smoothly. I'm not aware of the state changing any systems anytime soon, so hopefully we'll just continue to operate easily for that. Our public health nursing has added TB testing to the services, and so they've been able to help people in need of TB tests in the clinic, and we continue to figure out where additional services are that we need. We're working on a flu clinic. So all of those things are proceeding and progressing. In communicable diseases, didn't show up on the other list, but we have had a pretty significant increase in latent TB infections that have been reported to us. It's not infectious, so it's not a high risk to the community unless people were to break down with active TB. We still haven't had any active TB cases. I'm going to knock on something. But we are seeing an increase in that, and it could be from an increase in just people going back to the doctor and worrying about preventative measures, or it could be due to other factors. So we continue to monitor that, but we have seen an increase this year from what we started with last year. We obviously don't have a large data set to know what the normal is in Fishers. And then emergency preparedness, so we're getting rolled into some of the county processes and the Hamilton County Emergency Management process for emergency preparedness, participating in the radio drills. The state has some expectations that we conduct going forward an after action review for COVID. So we're working on all of those things, and hopefully we'll get some good insight into how to not have to go through this again. Although, for the record, I think we've done an amazing job without the blueprint. You can always improve, though. Mental health is what we expect. We know this is one of the reasons for creating a health department was to address mental health further upstream. So we continue to take this very seriously. Our CDC associate, oh, she's just come in. This is Renee. We're happy to have her here. So this is her primary job is to coordinate our mental health services and efforts. We've started with our community health assessment, and we've been conducting some focus groups with different groups in the community, and it's very clear we're fairly certain mental health would be at the top of everyone's list, and it's fairly clear from these focus groups that mental health actually is at the top of everyone's list, so it's given us some good insight into our residents and what's important to them and what they're experiencing as we kind of move this forward. So we are fairly certain that mental health is going to be our number one priority going forward. And as we look to next year, especially, I want to see a lot of momentum in this area. And I think our residents do too. So as we head into our next meeting and into next year, we do have to produce our annual report. So we'll definitely want to meet in the first quarter and get your feedback on what that looks like. Can't send you a draft too early because our data won't be ready. We don't have a draft yet for review, but we'll definitely want your input before we send that out. I believe it needs to be out for public consumption like beginning of April, before the first quarter is over. I look forward someday to transitioning our COVID services into regular operations and winding some of those things down. We're also working on some departmental mission, vision, and values so that everyone can kind of unite with a common understanding. So I'll be sending those around to you guys too, just for your feedback and input as we do that. We look forward to completing our community health assessment in 2022. Again, the mental health focus I mentioned, expanding some non-COVID related clinical services, continuing to do some staff development and training just as we grow as a health department, and get into best practice and things that aren't as COVID related. And then for 2022, we're looking forward to having a set schedule, hopefully with quarterly meetings for this group, if that's okay with everyone. And we'll be sending that schedule around after we send some availability questions around. Any questions?
I have two questions.
Yes.
Maybe more requests. And I don't want to blow Josh's mind here because I could see him going down a lot of rabbit holes. But is there a way for us to take a retrospective look at, I guess, for lack of a better term, Fisher's performance regarding COVID and managing that outbreak relative to other populations? Like, we were in the midst of it for so long, but now we are on what I hope to be the tail end of it. So there's enough data and enough time to look at, how did we perform relative to our peers regarding the COVID pandemic? And I know there's so many variables in that could be difficult, but it would be interesting to see some sort of retrospective view of, we're nearly 87% vaccinated in adult populations. I mean, that is in a state where you're hitting 50%. I mean, somehow those indicators, we've got 80,000 tests we've administered. I guess I'm curious whether those efforts have led to an outcome or a performance difference. Is that possible?
Yes.
Can I just say that that's the shortest answer you've ever given me? So,
Yeah, there are.
I don't know if that inspires confidence or not.
It is something that we've been thinking and talking about, and it is quite possible. And I do think, given the vaccine uptake, the size of the community, the mobility within this geographic region, coupled with just a quick anecdotal example, is that during the peak of the Delta wave, we started to have a statistically lower infection rate across different groups and across the community than we saw within Hamilton County, and at a higher vaccination rate. So and we've been running one of the most efficient mass vaccination clinics in the States. There are a lot of angles to go through this and to look at it.
Can we do a public opinion poll too?
Yeah, right.
From the people
Well, I
that
don't know
have
if
been
I
through
do
the
that.
vaccine?
But I think academically, I just think it would be interesting to look at it retrospectively. And you're right, there are a lot of different approaches or angles to that, but I feel like it's worth taking a look at because we did develop a proof of concept here. Now we just need to vet it out in terms of performance. I agree anecdotally that it seems as though it has made an impact, but it would be nice to do a deeper dive into that to identify that. And I don't know if that's something that we have the capability of doing in-house or whether that's something, to have a third-party review. I don't know.
Part of that might be part of our after action review. Some of that is soliciting feedback from people on what, and some
I feel
of
like,
it.
I
But
feel like
it's
what you're
not,
gonna get,
that's
like,
not the whole thing,
yeah.
right?
And I feel like my experience with these emergency preparedness after action review is like, we should really keep a stock of rubber gloves somewhere, which is that's like a different conversation than this discussion. So I guess my takeaway would be for your team to go back and is that a possibility? And does it make sense to even think about a third party to review objectively and say, okay, I don't know, but I'd be intrigued at the pursuit of that, I guess, is one thing. And then the second question I had was accreditation. I don't know if that's from a timing perspective or even whether it warrants us pursuing that. But what are your thoughts on that?
So right now what we're doing is we're operating as if we're pursuing accreditation, and the first step of that is a community health assessment.
Okay.
So we're trying to put all the pieces in place that we would need for accreditation anyway. There's a lot of pieces before you can even apply.
Sure.
So Josh has made up lots of manuals that are all bound nicely to remind us what's
Right.
required for accreditation. There are a lot of pieces, and they're shifting
Okay.
pretty frequently. But yeah, so community health assessment is one piece. Community improvement plan is another. There's like workforce development stuff, performance improvement stuff. Yeah. There's a lot of pieces to it. It's very, very expensive. So whether we want to be accredited or not, we're going to try to put the processes in place that are expected for accreditation before we make the decision. It'll probably take a couple of years before we're ready.
Okay. Well, Chief knows I have a healthy skepticism about accreditation typically, but if there's of value to it, be interesting to evaluate.
And I think that's the question. That's why I said, well, it's worth us doing the work because the requirements are really best practice. So we're going to operate like that, whether we need a stamp on anything and to pay money to somebody to tell us that we're doing the right stuff is another question.
Okay.
There may be at some point where they require that for certain grant opportunities and that kind of thing, and then it becomes a different kind of calculation.
Mm-hmm.
I think it would be super valuable to quantify our performance during COVID. I think that would be, especially the gaps and how we would fill those gaps if we did it again.
I think quantifying it is very feasible in-house, and it would make sense to have that externally vetted.
Yeah. And I break these into two different conversations. One is an evaluation of logistical challenges that we've had, which I think the chief is referring to, like where are our gaps logistically. I think there's another one about what is our overall outcomes and performances relative to other places. Both of those I think are appropriate to review so that we are prepared if this happens again. And then it's either affirming or constructive to tell us whether those things we did were effective, right? It's like one's efficient, the other one's effective. We can be efficient and not be effective. But hopefully we're efficient and effective.
Just for the record, Dr. Parikh is online.
Oh, great.
So I don't know, Dr. Parikh, if you have any questions or anything you want to make mention of.
Maybe Tracy heard him, I don't know.
Dr. Parikh, I apologize. We can't quite hear you. I can hear that you're talking, but I can't quite understand what you're saying.
Maybe you can catch up with them offline and find out.
Yeah, maybe we can check with you later. I'm so sorry. I do want to know what you said.
Anything from your perspective? Certainly adds some legitimacy, whether we like it or not, or whether it's.
It does add legitimacy. There are only, I don't know, 2 or 3 accredited health departments.
3 in the whole state.
I think there have been more that have
County
come
is
on.
accredited as well, and I believe
And the
there's
state just got accredited.
yeah, so I think that makes the third.
Yeah.
I mean, Monica's right. We've been thinking about this since the week I was hired. It's a multi-year process, but it doesn't diverge from how we hope the department will function, which is an evidence-based, when necessary, and evidence-informed.
Yeah, I think as long as it doesn't
Inappropriate.
distract from the mission and it's accretive to the mission, then if you're gonna be doing 90% of what they're already requiring you to do, there's probably value in that.
And many times the accredited body can provide support in other ways that you would not have.
I agree.
Mhm.
So,
I don't disagree. And besides, you're gonna have all kinds of money from all these shots you're giving anyways, so.
Is that real or we don't know?
We don't know.
We don't know yet. Yet to be determined. We're hopeful.
We're doing all this stuff.
Yeah.
We're doing everything we can do. You know, honestly, so I attended the APHA, the American American Public Health Association meeting in October, and the Surgeon General was on there, and I think one of the things he said was, you know, I want to know at the end of this that I did everything I could do, like that we did all the things that we could do to have the best possible outcome, and I think we're doing all the things, certainly that we can think of. And I feel really good about that in a way that I know that I wouldn't in any other setting, in any other health department that I know about. So thank you for the opportunity.
We left it all on the field. We left it all on
Huh?
the field. There's no question about that. No question. I think would be interesting, this is, Josh's dissertation world, but when you pair your efforts and efficiency at delivering tactical outcomes with the policies that we put in place, the regulatory environment, because we could have locked everything down in our community for an extended period of time and had a particular outcome. But we balance that with, frankly, the performance of the health department and its ability to provide testing, its ability to provide contact tracing, its ability to provide vaccinations early and effectively. So were we able to affect the same outcome that others had to do by draconian lockdowns because we outperformed in other areas? It's that kind of interesting conversation and reflection that would be interesting to kind of tease out from an academic perspective.
You can go deeper, compare what we did, and then that economic health of the community, the cultural health of the community, compared to what we did to what other communities did. You can really go deep, like you said, out there.
Yeah. I mean, so Josh, if you want to take all that and just try to figure that out, but that's what you went to school for, man.
I will approach it from a very systematic and scientific approach, and then any value judgment that's added on or taken from it is outside of my scope.
That'd be good. All right, anything else for the good of the cause? It's Friday afternoon. It's been
Thanks,
a busy
everybody.
week. We don't need a motion. I think I think we're good.
Not even a motion to end the meeting? Come on.
No, I think we're
Like, you got a
fine.
gavel. You should do something.
Here, meeting adjourned.